Good morning on behalf of Patient Choice in Chemin Neuf, Pointe, Michel. I'm Dr. Dale Dangleben with your daily medical education tidbit. I want to talk quickly about aspirin. Aspirin is important because I talked about NSAIDs, the non-steroidal anti-inflammatory drugs, and aspirin falls under that category. Most of the time, we don't think about that. We think of the ibuprofen, the diclofenac, etc. But aspirin has been around for a very, very long time. It's one of the oldest and most widely used medications in the world. You know, I just want to briefly get into some really basic science. It blocks the synthesis of a substance called prostaglandin, right? And prostaglandin is responsible for inflammation and pain and fever and things like that. So if you block the prostaglandin, you're reducing, inflammation. You can help with pain and you can lower fever. So that's the whole point, in all of this. In low dose, aspirin actually inhibits your platelets that causes your blood to clot, right? So it inhibits what we call platelet aggregation, right? And it's an antiplatelet agent. So remember that term, and that's why it's given, to prevent heart attack and stroke and things like that. So it's one of the primary benefits of aspirin is the heart, the cardiovascular benefits, the protective effects of aspirin, right? So that's why they talk about the daily low dose, 81 milligrams. I'll talk a little more about that in a bit. Musculoskeletal pain, arthritis, reducing fevers, aspirin, is that, right? So that's important. Now, things you have to be cognizant about that I talked about when I spoke about NSAIDs is the gastrointestinal irritation, the ulcers, the bleeding, etc., and also the effect on the kidneys, right? So the routine use of aspirin like it used to be is not as common, okay, because there are side effects that I mentioned, okay. So it's a good medication for the cardiovascular protective effect, the antiplatelet effect, right? Now let's get into what the dosage means. Low dose, which is called baby aspirin, right? It's called a baby aspirin because the low dose is 81 milligrams. Remember that, okay? And these are available at Patient Choice in Pointe Michel. So the primary use of the low dose is the cardiovascular protection, right? By inhibiting platelet aggregation, the platelets don't clot together, all right? So that reduces your chance of blood clots, all right? So it's good, to reduce for heart attacks, strokes in high risk patients. Right? If you have a stent, you hear about stents being placed in the heart, etc. It can also be used for patients with stents, so again, to prevent the clotting. All right. If you've had a heart attack, if you've had a stroke, usually that's indicated. The standard dose of aspirin is 321 milligrams. That's the main dose, right? And pain relief, fever reduction, and also obviously anti-inflammatory that I mentioned before. So you have a headache, you have a muscle ache, you have arthritis. Again, you manage your fever, 325 milligram a day. A dose, right? And you would take that every 4 to 6 hours. I would recommend every 6 hours, right? You do not want to exceed more than 4,000 milligrams of aspirin per day. And there's actually high dose aspirin, which is like 500 to 1,000 milligrams, right? That's if you have things like, severe inflammatory conditions, if you have what's called pericarditis, inflammation around the heart, rheumatic fever, these kind of things. So typically you want to stay away from high dose aspirin. And if you're going to take that, you definitely need to talk to your physician and have the physician's guidance. That's also important. And I will end with this. I want doctors to take the time to explain these things to the patient. Don't just give a patient a bottle of aspirin without telling them the side effects, right? It can be hard on the stomach, it can be hard on the kidneys. It's a non-steroidal anti-inflammatory drug, but its benefits also can be highlighted, right? If you're going to get something for the stomach, you have the enteric coated aspirin. that has less of effects on the gastrointestinal system. Right, so just a brief summary on aspirin. We do have 81 milligram low dose aspirin available at patient choice. And again, if you're high risk, right, if you've had a stroke, if you've had a heart attack, all these things, I would advise that you take your daily aspirin. On behalf of Patient Choice, I'm Dr. Dangleben. Have a great day. Peace.